going to be asking a few questions about the industry, for Max, and this will be recorded, and the time Max allowed for this interview will be 15 minutes.
Okay.
What were the experiences or individuals that brought you to this industry?
So my experience that brought me to the x-ray industry, I was in my first year of college and I stepped off a curb and broke my ankle. And so I went through multiple x-rays, MRIs, and I kind of got interested in it, so I inquired from my tech that did all of my exams. So it was very interesting.
That's kind of what happened with me. Being in the military, I was with the x-ray, getting x-rays a lot, so
Gotcha.
I was trying to just get out, but then before that I was just thinking of staying in and reclassing to it, but just got medically discharged, so I wasn't able to do that. And then I just kind of figured, cause when I got medically discharged, it wasn't going to do anything because I tore my labrum
Right.
and my bicep tendon, so
Okay.
I couldn't do anything with the infantry, and then
Yeah.
it's kind of too late to reclass, so kind of just went with the med board. How do you see AI transforming the field of radiology?
I see it definitely getting more advanced. I mean, we've gone from doing film with chemicals and developing to digital image receptor plates. So I see it just kind of increasing from there. They may end up being able to do something all in one point versus having, multiple different components to it. So
What exactly do you think would advance more in imaging?
definitely, probably the dosage of radiation. I mean, the smaller the dose, the less likely the patient has to, especially if they're getting constant X-rays. So if they can more bring that dosage down but increase the quality of the picture, then I think it definitely would benefit patients.
Okay. How do you ensure imaging findings get directed to doctors correctly?
So once I take the patient's name and everything from them, I verify it in the computer system, pull up the imaging that their provider typed in a specific code for that exam, do the exam, and then we send it to our radiologist to get reviewed, and then they submit the report, and within the system the report goes to the patient's primary.
How long normally does that take in the process?
Normally 2 to 3 days, if maybe sooner. It just kind of depends on if it's a stat patient or a routine. So
Did you have a chance to review my resume?
I did.
What do you think? Any skill sets that I could improve, or anything I could improve based on my resume that would help me in this field?
I mean, everything looked really good. With you being in the X-ray program, and it's just a 2-year program, I didn't want to settle for just an associate, so I went on to get my bachelor's in radiology. So that's definitely something maybe you could pursue.
And how long does that take?
So I went through Midwestern State University. You can take as many classes as you want at a time. You have, I think, up to 5 years to finish the program. It's a BSRS, so once you get your RT, you can branch to the BSRS program. And I took them 2 classes at a time, cause I was working full-time, so it took me 3 years, to 3.5 years. But if you take 4 classes at a time, it could probably take you 2. You take 4 electives, and then I think it was 8 required, according to their syllabus, so.
Yeah, I think that's what I'm planning on doing. I wanna just get a feel for X-ray tech, and then
Yeah.
I wanna go back to college and possibly go to, into MRIs.
Yeah.
But I think I wanna just stay with X-ray for a couple years, maybe 4, 5, 6.
Yeah.
And then when I have time, go back to college for it. But, this concludes the interview. Thank you so much for taking your time to have this interview with me. I really appreciate it.
You're welcome.
I did learn a lot, especially with the bachelor's and the steps after, doing X-ray, 'cause that's what I wanna do. Like I said, I wanna take some time with X-ray tech and then
Yeah.
go back to school.
I
for further.
definitely recommend, if you find that you like MRI or even CT, different modalities are definitely interesting. I know when I was in my X-ray program, during the summers, we did, rotation through the different modalities. And once I was in my bachelor's program, unfortunately my dad was diagnosed with a brain tumor. And so I kind of stepped more into the MRI, research kind of thing when I did my bachelor's. So all of my elective classes, I decided to go for the MRI. And when you go through a program like Midwestern State University, the ART will take those, those class credits and turn those into the education portion. So if you find a facility that you're working at that will let you do your comps, under the MRI, list, cause you have to have certain amounts of like head, abdomen, stuff like that for MRI, to get checked off, and then you can sit for your MRI board. So that's something that I wanted to pursue, because my dad was diagnosed with a terminal brain tumor. He passed away a year later. But I found that all of my bachelor program research papers were based off of his brain tumor. Cause when he was diagnosed, I did a lot of research about it. It definitely, I don't know if it could have been prevented, but when he was first showing symptoms, they said, okay, let's do an MRI in a couple of months. Cause the first MRI had like a little hazy spot. So when a few months later it came time to do the MRI, they told him, we're waiting on a part for the magnet. We'll, we'll give it next month. And they kept on putting it off instead of sending him somewhere else to get that MRI. And by the time they finally did the MRI, it was completely like blown, like it was huge. So I feel like the delay in care, probably, he could have gotten treatment right like 3 months before they found it, if they had not just put it off, saying that they were waiting for a part, and they could have sent him to another facility. So I definitely will probably find myself in the MRI field one day, and maybe in the research department as far as what can we do to maybe help patients find their cancer sooner. So.
Yeah, I just found out recently, I think last month, that I have a lesion. Well, it's a benign lesion, but it's in my liver. So, and then my uncle just had lung cancer a couple months ago as well.
Okay.
So yeah, I understand, but thank God they actually got it out.
Yeah.
So there's not a lot of us left.
Yeah.
Thank you for taking your time.
You're welcome.
For this interview. I really appreciate it.